Yeah, we would like to talk about the unconscious patient. First, we have to try to find out what is unconsciousness. Basically, when we talk about somebody to be unconscious, it simply means that the person is not responding to what stimuli. That is, the person is unresponsive. That's what we mean by unconsciousness. But first, before we continue to talk about unconsciousness, there are other related issues when we are talking about unconsciousness. That is, some people may take somebody to be in shock or coma to be unconscious, but these are related other things to unconsciousness. When we talk about somebody to be in shock, shock is simply impairment of blood circulation, and it can happen in so many conditions, like we have anaphylactic shock, septic shock, and the rest. So normally people who are in shock are conscious. They may only be sweating profusely or may have a rapid heartbeat or something like that, but most of the times you'll be able to take a good history from them. You know. But when somebody is unconscious, it's unresponsive. So normally you taking history from the patient is impossible. You can only do that through the relatives or maybe the paramedics who have brought the patient to the hospital or delve into the person's past medical history, trying to find out whether he's a diabetic or hypertensive or have some other um, disease conditions which might lead to the person to become unconscious. Another thing you should note is that when we talk about coma, coma is very related to unconsciousness because a prolonged unconsciousness is what we call coma. So if somebody is unconscious for a prolonged period, then we talk about coma. The causes of unconsciousness, in some cases are obvious. For example, somebody who is involved in a road traffic accident who have a severe hemorrhage may become unconscious. Somebody who receives a blow to the chest or the head may become unconscious. Somebody who abused alcohol may become unconscious. Drug addicts who may have taken some drugs or may have injected some drugs may also become unconscious. So, some cases like maybe for example severe hemorrhage, you see that it's obvious that the person is bleeding profusely, and that is why the person has become unconscious. But there are some other causes which are temporary. For instance, somebody may be a hypoglycemic, meaning that his blood sugar is low. So he may become temporarily unconscious. Somebody is dehydrated. Somebody's blood pressure is low. All these people may become temporarily unconscious, but their own is not unconsciousness which cannot be reversed quickly. So there will be called temporal unconsciousness. Now, how will you know whether somebody will become unconscious? For you to know that somebody will become unconscious, there are some signs. Maybe the person will tell you, I'm feeling dizzy. The person may have a slurred speech. The person will say, oh, I'm having a rapid heartbeat or that kind of thing. That may give you a sign that the person may become unconscious. So quickly you may try to save that patient. But most of the times it is something that you will not be able to detect. All you could see is that the person has become unconscious. Stroke patients may also become unconscious suddenly. We have non-convulsive epileptic attack. When you have somebody who has epilepsy and he has status epilepticus, he will be convulsing, you will see clearly. But you have the non-convulsive where the person may have an epileptic attack but will not be convulsing, just be unconscious. So that can also give you a challenge for you to know exactly what is causing the unconsciousness. What you should critically take note of is that When we are taking care of an unconscious patient, we are doing everything at the same time. The four major things we do for a patient: taking history, examination, investigation, and treatment, they are all going parallel. You're doing all at the same time. If you don't do that, you lose the patient. So that is very critical for you to know. And normally, people who are unconscious, they need very experienced hands to take care of them. So this one is not left in the hand of, inexperienced doctors or this thing. So people who are unconscious, and all the medical disciplines will be working at the same time, depending on the condition. Some may need the surgeon, the physician, the psychiatrist, and all at the same time working on such a patient, because the diagnosis will be unclear. You see, because the person cannot talk to you, is unconscious. You try to find out his past medical history, it's not giving you any clue, and all this. So it becomes very difficult to actually establish diagnosis in the unconscious patient. Now, when we come to talk about investigation, what investigations are you going to do for somebody who is suddenly unconscious? The first thing we always do is to take the blood sugar to find out whether it's due to hypoglycemia. So when you check that, if the blood sugar is normal, then you go into other investigations like a CT scan of the brain to find out whether it's a cerebral hemorrhage. Then electroencephalogram, EEG, which will give you a clue whether it's due to epilepsy. But as we all know, when we are talking about somebody who is unconscious, the Glasgow Coma Scale comes into play. What is the Glasgow Coma Scale? The Glasgow Coma Scale is basically something which you use to assess somebody who is in coma. And as I've already said, that a prolonged unconsciousness is what we call coma. So certainly, in an unconscious patient, you have to use the Glasgow Coma Scale. The Glasgow Coma Scale have three parameters. Number one is the eye opening, whether the person is opening the eyes. What will you do for the person to open the eyes? So you look at the person to see whether the person's eye is open or is closed, and that one is assessed over 4. So from 0 to 4 scale. When you come to the verbal response, that one is also assessed from 0 to 5. So maybe you call the person's name to see that will respond. That is how we check for a verbal response. Then we come to the motor response, which is 0 to 6. So for somebody who is not moving, is unconscious, you try to what? Maybe you can press on the person's eye region or press deeply on the chest with your fist to see whether the person will move or whatever. And then that is assessed from 0 to 6 to see. If your Glasgow Coma Scale altogether, if the person is fully okay, it should be 15/15. But the moment is less than 8/15, then you see that the person is in deep coma. So how to take the person out of that deep coma is critical. One thing you have to be very aware of is that sometimes somebody who is unconscious, you will not even have time to take a history, do any investigation. You straight away start with what? Treatment. By going with your what? ABC. ABC, we are always talking about ABC, but the D and the E, people don't actually concentrate on that, because the ABC, A is airway, B is for breathing, C is blood circulation, D is the person having some disability, and E exposure, meaning that you have to remove everything from the person, look at the person's all parts of the body, expose the person to see what is actually going on. So if you do your ABC, if the airway is blocked, make sure you clear the airway first before you give oxygen therapy. Then you come to the breathing. If the person, you realize that it's in deep coma, you need to intubate the person to give oxygen actually by intubation, but not by giving a mask for the person to be able to breathe, or nasal prongs to give oxygen. If nasal prongs are not working, then you have to go to intubation. Then the circulation, you have to get your IV access. As you take the IV access, certainly you take your blood samples to the lab to check for other things to see whether the person is anemic and all those things will come in when you take the IV access. Then disability, of course, from road traffic accidents, due a fracture of the femur or whatever, which may be causing the coma, the unconsciousness in the patient, all those things will come into play. Now, most people who are unconscious, they need CPR, and the CPR means cardiopulmonary resuscitation. Cardiopulmonary resuscitation, you must be trained to be able to do that. At least you see some people doing cardiopulmonary resuscitation, but you don't sit down and think that you can also do it. You see, it's something that you have to go through the training to be able to do it. Normally, you put the heel of your hand on the middle of the chest, then the other hand on top of it. Then you press the chest. At least you should be able to do those chest compressions at least about 100 times in a minute. Then we come to what? The mouth-to-mouth rescue. The mouth-to-mouth rescue, normally you must close the nose by pinching it like this before you take your mouth to completely cover the mouth of the other person, and you be blowing into the mouth and see whether the movement in the chest, meaning what air is getting to the lungs for the person to be able to breathe. But in cases of unconsciousness, what you should know is that don't think you can do it alone. You must quickly call for help. But initially, when you see somebody who is unconscious, certainly you will try to resuscitate, by trying to checking what the oxygen saturation, the pulse, and all those, because mostly people who are unconscious, they cease breathing. The pulse may be faint and all that. You will also be hearing about people that if they say somebody fainted, when the person fainted, that is a temporary form of what? Unconsciousness. Somebody may faint just because enough blood is not getting to the brain. That's what you call syncope. Or somebody may faint because of what? Low blood sugar or low blood pressure, all those things happen from time to time to people. So handling an unconscious patient is a very critical issue. And once again, I want to actually, tell you that you cannot do it alone. You need assistance, and that must be prompt. Thank you.